When I think of this program, a word that comes to mind is rewarding.
I've developed relationships with people that I see as lifelong friends.
When I think of this program, the phrase that really kind of encapsulates the whole thing for me is work hard, play hard.
The program averages out to be a perfect balance.
When I think about this program, the first thing that comes to my mind is just well-rounded.
When I think of CU plastic surgery, I think come as you are.
Lots of times I'll show up to clinic and I'll introduce myself as the new plastics intern, and immediately they're like, oh my gosh, we love having plastics residents, you guys are always awesome.
We just started, but we're already very close to a lot of the junior and senior residents. And then outside of work, we always try to find time to hang out and do things that we enjoy.
I love my faculties, I like my co-residents. Everyone has been great, and I think that's what makes this program great for me.
One of my favorite experiences we have here is our junior meeting with one of our faculty, Dr. Wong. She takes all the first through third years out every couple months for dinner and drinks, kind of for like event session where we just kind of hang out, talk about the program, voice any concerns we have. And to me, it really kind of is the epitome of wellness, because like your faculty care enough about you to take you out on their own dime.
For years 1 to 3, I am the mentor for general concerns. For years 4 to 6, they meet with another attending. And sometimes when someone has an affinity for a subspecialty, they form an organic bond with an attending in that subspecialty.
I love the collegiality and the camaraderie of this program. I enjoy seeing my residents during the day and enjoy seeing them during cases. I love interacting with them outside the hospital. I really think that we are building a family program here at CU, and that's probably the most important thing, I think, to our success and the happiness of our residents.
We start out doing some general surgery in the first 3 years. You know, it's about 6 months, our intern year, half and half of plastics and general surgery. During our second year, we do a few months of general surgery, but really progressing. We start taking call as plastic surgery residents, as buddies. And then by third year, you're really down to almost all plastics. And then your 4 through 6 years, totally plastic surgery and related specialties.
Yeah, and I'd say a huge benefit of our program is because we have so many surgeons operating at the same time and so many rooms running simultaneously. Really starting in your third year, you're first assisting on cases, and so you're getting great exposure after you're done with your general surgery and learning plastic surgery one-on-one with the attendings.
We've really developed programs in all the various aspects of plastic surgery. So I think it's unique to have a limb salvage program. We have a very busy breast reconstruction program with a focus on microsurgical breast reconstruction. We have a very robust pediatric plastic surgery program.
I am the chair of plastic surgery over at the Children's Hospital. We do have our residents rotate through, and they're exposed to the whole array of pediatric plastic surgery. That includes everything from craniofacial surgery, cleft surgery, to congenital hand, now pediatric microsurgery, facial reanimation. The list goes on and on.
We also have some unique programs, like we do a fair amount of transgender health, and we do have a cosmetic clinic that also allows residents to get some experience in seeing cosmetic patients, having their own cosmetic patients, and learning some of the newer techniques that are available.
My favorite part of the program are the co-residents, the people I get to train with. We truly enjoy each other's company, and when you're working hard, it's great to be around people you enjoy spending time with.
I really think that the people make all the difference when you're choosing a program. Not only is it like really collaborative and fun for us to get together as a whole group, it's really educational.
I remember when I was interviewing for residency, people talked a lot about how curriculums change, faculty change, and what's going to stay constant are your co-residents. So it's really important that you get along with them and that you can, do hard stuff with them and hang out.
The CU program in plastic and reconstructive surgery is on the forefront of change within the specialty itself. We foster education, we foster diversity and growing that within the field of plastic surgery. And we're also looking to push the boundaries in research and clinical care by a lot of our amazing research programs and faculty members that have pretty unique and interesting grants. And so I think that sets us apart from other programs. we don't just have the clinical facets, but we have everything else as well.